California is a symbol of opportunity, a backdrop for dreamers and doers. Geography as diverse as its population. Choose your climate. Choose your lifestyle. Adventure awaits. Come discover your California.
I was one of those people that knew I wanted to be a doctor since I was really young. I had interest in underserved populations. Before I worked for the state, I worked on faculty at a university where I did a lot of teaching for residents and students. We have a high-risk population. We need providers. So as part of this mission, it's important that we are able to attract and recruit quality providers.
There are lots of different types of positions available.
There's opportunities to go on site, which is a great experience. There's opportunities to do telemedicine. It's the mesh of technology and practicing medicine with technology. I found that to be very intriguing.
We're renovating all of our institutions. Once you're in the clinic, you won't be able to tell, and it'll almost be like any other community clinic on the outside.
You know, I think what surprises most people is how remarkably similar this is to working in other clinical settings where we get to work. Granted, we're going through a couple of different gates to get to work. We have a line of patients that are scheduled, and we kind of just go through our line. You actually have time to talk to your patients, you have time to do the appropriate charting, and you get to finish up your paperwork and go home not too long after you're done seeing your line of patients.
I love working in the telemedicine department. I have providers right next door to my office that I can just knock on their door and get advice anytime I need it. You know what keeps me coming back every day? It's just the environment I work with, the colleagues that I work with. I get to interact with a lot of different programs. You know, it's not just medicine. You get to interact with dental, mental health, with custody, with nursing, with IT. And it's that excitement as working as a team, as a whole, that keeps you coming back.
I think one of the common myths that people have is regarding safety and security.
Of course, when you're in a prison, you're thinking about safety and security all the time because you're in a prison. But in reality, I feel it's safer to work in a clinical setting in a prison compared to the community. You have a relatively small patient panel, very family-friendly work hours, competitive pay, great pension.
Being able to come to work and work in a clinic that actually has been updated, is clean, you know, that's always a nice plus. I think our patients will feel better about being seen in such a modern and pleasant environment as well.
I'm hopeful we get people on the outside looking in to consider CCHCS. We have a lot of opportunities out there. It's challenging, it's fun, it's interesting, it keeps you on your toes. So we're looking for individuals that are looking for a challenge.
Right now, it's kind of a hidden secret, but I'm hoping that the word gets out.
Your work-life balance is waiting in California with California Correctional Healthcare Services. The next step is yours. For information about CCHCS and our employment opportunities, contact us at www.cchcs.ca.gov.